is, you have to be able to provide the customer service. If something is going wrong with the application, if something is going wrong with the device, somebody needs to be there to really walk the senior through and make sure that you can get it working again for them.
Right, and I think Jitterbug definitely illustrates that strategy with their the services store, which is sort of your version of an app store. We've seen there's at least 5,000 different health and medical apps out there for smartphones, but Jitterbug's taking a different approach, very much a customer service focused one with their services store. They actually launched recently just a couple of health related services, isn't that right?
Right. So our customer service is always there to actually help you set it up. Or in some cases, we focus a lot more on the preventative side, so where it's not quite as fancy as all the connectivity and things happening monitoring people, but we do simple things like give 24/7 access to live nurses, or we have wellness calls that are really about relaxing and motivating our customers to make sure it's keeping people's minds sharp and focused to be preventative of future health complications.
Thank you, David. And so, Ken, we know this isn't just about the mobile phone. There's a number of different form factors that wireless devices can take for wireless health. And I know that MedApps has been building out a portfolio of different device form factors and with different groups in mind. So I was hoping, in the spirit of this being CES and somewhat of a gadget show, it's not just about the technology, but it is important, especially to keep in mind which groups we targeted by which devices. If you could just run through maybe some of the different examples out there in the industry and those that MedApps are offering and which groups they're targeting.
Sure, not a problem. When we first started out with a cell phone. This is 3 or 4 years ago. We started out with a Nokia cell phone and got FDA cleared for it, doing Bluetooth. And we realized at the very beginning when we started putting the cell phone out that the population that we're going after, the disease management population we're going after, had some endemic problems. They were my senior population and my Medicaid population. So I kind of call it my either unused or abused kind of philosophy, that there are endemic problems that are in both parts of it that I wasn't getting. Either the iPhone wasn't being used, or the Nokia wasn't being used, or it wasn't being returned, or I was getting a $700 bill for downloading music on it as well. So we went through and looked at, differentiated the market. We looked at that 5% that consumes 50% of the healthcare costs today in the marketplace. That's the chronically ill and the sickest of the sick. And then there's 95% below that consume the other 50% of the healthcare costs. So we went through and created a device called the Health Pal that goes after that 5%. It's a PhD, it's a personal health device that all it does is sit there and collect information from scales, blood pressure, pulse oxes, either Bluetooth or USB or 30-pin connectors. It sits in the background. It's interesting. We're in a study at Cleveland Clinic, and we're getting ready to do a paper on. We call it my first 5. My first 5 people I put on congestive heart failure people. I put two of my congestive heart failure people. I went 3 months later to look at their devices, and they were covered with dust, and it really made me sad, because I'm saying, what the heck's going on with this? And it's because they never had to touch it. They could just take their readings all day long, like this pulse oximeter here that is from Nona and that has Bluetooth in it, that goes through and will send it automatically over to the Health Pal device and upload it to the back end, either Google Health, Microsoft Health Vault, Epic, or any one of those. It talks to you.
Your pulse ox reading is 95%.
So it'll go through and do it seamlessly. You did 95%? I think I need to jog a little bit more, but anyway. And I give you permission to look at my personal health information. Don't worry about that. So we've got for the 95%, for the 5% we went after that, just invisible in the background. For the 95%, I see that more as a wellness application. I see that people are carrying around smartphones out there, and we want to engage them at whatever level we can. From our standpoint, we don't see the market as a direct-to-consumer play. Direct-to-consumers aren't willing to pay $399 for an extra gadget out here, and they're also not willing to pay $3.99 for an iPhone application in Ubiquity and use it. After they download it, those 4 billion that are downloaded, they get used in 30 days and never get used again, especially in healthcare. So one of the things that we're going to be doing in this is try to create sticky factors. We're going through now and taking the iPhone like Don showed, and we're going to be working with users to go through and create a docking station for the iPhone as well, which is coming out in the next couple months. That will give it access to USB, 30-pin connectors, Bluetooth. It'll be continuum compliant. It allows that population that's 95% below the line to be able to send up biometric readings seamlessly while they're charging their iPhone. We need to create services that engage users at their level and their cost structure as well.
Thanks, Ken. So, Mike, these devices might connect directly to smartphones and other phones with Bluetooth. Apple actually highlighted this at one of their recent events last year. They had the Johnson & Johnson LifeScan blood glucometer connecting via USB, but with an eye toward Bluetooth to the iPhone. So is that a trend that's that you see accelerating? Is that actually coming to the market soon? And also, what other ways can we expect to see Bluetooth incorporated in wireless health?
We are seeing many of those applications starting to hit the market. I mean, we see some of them up here, but first the groundwork had to be laid, and that's been done now. And so I believe that this year and in the future we're going to see an ever expanding number of applications. And what Bluetooth brings to the table is that local connectivity, is that ease of use, and as has been mentioned, these applications really have to be transparent to the user. When they bring them home, they need to work. You can't be playing around with them the whole time to get them to work. And I think that's the enabler in that Bluetooth brings to the table. And then also, a lot of applications that Bluetooth is being used for now isn't just in the home healthcare market, but also more in the hospitals or the doctor's office for ease of use and convenience in that area as well. For example, at this show, one of our members, 3M, has Bluetooth and a stethoscope. And, it's how long has that been around? 100 years or something? And, how does adding connectivity to that device make it better? Well, all of a sudden now you've digitized that signal, your heart rate, and so it can be stored over time as part of the person's personal record. You could use it at home if you have some sort of condition, have that uploaded so that all of a sudden there can be back-end processing on that to see if the heart rates, if you see any trends going in the wrong direction, and notify the person to come into the office. So all of a sudden having even traditional type of medical devices be connected wirelessly simply improves the entire system as well, and we're seeing a lot of that development also.
Right. Thanks, Mike. I think now just that we have a kind of a base introduction to each of our panelists, just a few quick questions. We've heard a few discussions today about who pays for these devices and these services, so I think it'd be interesting to hear if the fact that we're adding wireless and adding a few new players like wireless carriers, if that changes at all. So if we can, just to go down the panel, starting with David, who do you see paying for these services? How does that change depending on the service, and any hope for reimbursement?
Well, I think, first and foremost, if we keep waiting around to find out who's going to pay other than the consumer, we're not going to get anywhere. So the first stage is going to have to be the consumer for innovating and leading in terms of things that are going to benefit them. So that's where our focus is initially, is to just get out there and create services that are compelling enough. I mean, people have been paying to go to gyms for 30 years now. I mean, it should be the same thing. People are willing to spend money on their health and wellness if it's a compelling and effective solution. But secondly, I think what we're finding is obviously the only payers, or other than private pay corporations, are going to be people that are using some sort of capitated system where they're actually motivated to reduce the cost of their base. So really, I think the people that are going to be going there are the private corporations and any kind of capitated providers or payers that have a motivation to go. Because anyone who's still on a fee-for-service, they just don't have any motivation to go and reduce the cost of their health of their members.
And I agree with that. I see a ton of innovation in the preventative area. People are willing to pay for that, and typically those solutions now are based on proprietary solutions, and that makes it hard for the manufacturer because a good run of those products is 20, 30,000 units, and they've been very excited working within the Bluetooth SIG to standardize that, and now all of a sudden, instead of having to have a proprietary solution, they have one that can connect to the billion-plus mobile phones, and they see the market just exploding for those